For the latest COVID-19 news and updates, visit Hartford Healthcare's coronavirus website.
All right, good afternoon, everybody. I'm here with Paul and Josh, and two special guests I'll introduce in a minute. Sorry to be a few minutes late this afternoon. We were just on a Zoom teleconference with the Connecticut Business Roundtable, just to get their sense of where we are. Sort of interesting. They said, we want to go slow, but we can afford to go slow. Most of these companies, outside of the manufacturing, but the finance and the such, could afford to telecommute. And they said, ironically, maybe not ironically, productivity is up. And they're doing well from that point of view. So there are no rush to go back because they don't have to. But it can be emotionally exhausting being alone at home, which many of them are, or they're speaking for their employees. It was learning just as we try and keep learning from each other and listening to people along the way. Let me just give you a short update on where we are, because today we're going to try and lay out where we stand on some of the key metrics, PPE and testing in particular, because those are key to our May 20th date and to how we're going to get there and do it safely. The daily summary, I think, is reflective of what you've seen over the last week or so. Again, tests performed are continuing to ramp up, 5,916, and positive tests at least continue to be under 10%, which is a good metric. Continue meaning only all the 3 days, but that's a step in the right direction in terms of what we want to see. As you're going to hear from our folks, Marna Borgstrom from the hospitals, hospitalization continues to be a key metric, and that drops, I think, for like 18 straight days. So that's a really important metric. Hopefully the fatalities continue to go down. The day-to-day change in hospitalizations, like I said, you see that is meeting that metric, and that's so important in terms of capacity, making sure that we have the hospital space necessary if there was another surge. And also as a reminder that hospitals now are beginning to do more and more so-called elective surgery. A lot of this elective surgery is important surgeries that should not be put off. So I'd urge you to contact your physician and contact your hospital as needed, because there is some capacity there now. The current hospitalizations by county, I think you just see that the curve is not stable, the curve is bending down, and that's incredibly positive. And then the day-to-day testing change, I think, is a really important metric in terms of the fact that, again, you see the long-term trend, long-term since what, about April 21st, is generally trending down, and we've chipped under 10% like most other states, and that's a positive. Finally, daily testing performed is where we're going to spend a fair amount of today. As we continue to ramp up our testing, I think you remember us saying a week or so ago when we had the reopened Connecticut folks here that testing is a key metric. We wanted to ramp that up to 42,000 tests a week. And I think you're going to see that we are getting there. What we're doing today is going to be reintroducing you to Marna Borgstrom from Yale New Haven, CEO there. We've done a lot of work together, really strong collaboration with the hospitals as we rode our way through what could have been a horrific April, and was horrific, but at least we always had the capacity in our hospitals. And Oro Nair, who is in charge of diagnostics and testing at Jackson Labs. Two partners who have come together with us, and thanks to Kevin Lembo, we're able to put together contracts, is how we'll be able to ramp up our testing in a very significant way. As you know, testing is important just in terms of being able to diagnose outbreaks before they happen, really focus on vulnerable populations. I think you'll find from Marna and Oro how important that is. Yale New Haven is going out to Fairhaven, they're going out to Hill, they're going out to those communities. Hartford Health, another partner here, is continuing to take the testing out where folks are. We're ramping up our work with the pharmacies. As we said, we're going to be able to do more of the testing there as well. And this is just so key to making sure that we're not just testing, but we're keeping our vulnerable population safe. And we'll be rolling out the pharmacies as well, like I said. I would just tell you that in terms of testing, we did about 18,000 tests a couple weeks ago, doing about 29,000 tests a week now, and I think we'll be surpassing the 42,000 tests a week next week. And what that means in terms of giving you some comfort that we're able to test everybody at the nursing homes, testing the vulnerable population, testing the folks in corrections, testing each and every one of the first responders who are taking care there, and also beginning to ramp up our testing more broadly to some symptomatic and asymptomatic, and we get a better perspective of what's going on in terms of community spread. And we were talking earlier with Oro and Marna. I was sort of interested that they're not just doing the traditional PCR testing, but in many cases they're also doing the saliva test, just to test the test as we ramp up to see whether we may be able to do that as a faster, less intrusive and less expensive way to go forward. Before I introduce them, I just want you to know that another one of our key metrics outside of hospitalizations and positivity and testing, which we're about to talk about, was PPE. And that's in particular the protective gear, that's the masks, that's the gowns. And I've complained, I suppose, before that I just don't want to sit around waiting for the federal government and the national stockpile to get around to giving us some of the gear that we need. We've been working very closely, with Josh and the team over the last couple of months, staying just ahead of the posse, so to speak, in terms of making sure that we get the key PPE out there where it's needed, but not with a lot of margin for error. That's changed in the last 72 hours. In the last 72 hours, we were there at the New Britain warehouse where our amazing guard have got that outfitted, and we've delivered more surgical masks in the last 2 days than we have given away in the last 2 months. And that means we have a supply of masks that ought to give some support, not just to our first responders, not just to our amazing folks at the nursing homes, not just to food service workers, but also be able to provide some to those smaller businesses as necessary as well through the CBIA website. In addition, you see the surgical gowns. That's twice as many surgical gowns as we've received to date. I know the hospital is able to get some of the surgical gowns themselves, but this gives us a lot more flexibility. The thermal thermometers, when I was talking to the CEOs of Pratt & Whitney and Stanley Black & Decker and EB just this afternoon, that's another early warning indicator. We've got 100,000 thermometers, which we'll be allocating to businesses large and small as needed to make sure that that's a way before you go into that store, go into that grocery store, go into that factory. We have an early test. So whatever we do going forward on May 20th, I want you to know that we're hitting those healthcare metrics like a hammer right now, a nail in a hammer. And we want to get this right to give you, the customers, consumers, some confidence that it's safe to slowly start getting back, give employees the confidence that our healthcare leaders have and our scientists are leading the way. But most importantly, we're not going to be able to get that done unless we continue to ramp up our testing in a serious way. And that testing is going to go up to 42,000 a week by next week and well over 100,000 a week as we move through June. And this is going to give you the confidence that we have this virus more or less under control. At least we can see what's going on there as a bridge. The testing is a bridge to the vaccine. And whether that's end of this year or next year, we'll be ready. With that, it's my great pleasure to reintroduce to you Marna Borgstrom, who's been a great partner, along with all the other hospitals, helping us navigate through April and what goes forward from here. Marna?
Well, thank you, Governor. And, it's an honor to be here and a lot less intimidating than the first time we came up when none of us had any idea what to expect. And, I think on behalf of all of us who are in healthcare leadership, we have to thank our staffs. And this is actually Nurses Month, but particularly Nurses Week. And I think that most of the providers in any of our organizations would say the nurses are the heart and soul of our organizations, and they have really put that heart and soul into caring for COVID-19 patients and have done a spectacular job. I'm really delighted to support, the governor said we have seen a continued decline in inpatient hospitalizations and a decline in intensive care utilization and in mechanical ventilators being used on patients. Bridgeport Hospital, or Greenwich Hospital, which was the epicenter for a lot of the outbreak in the state, so close to New York, at one point, as a 200-bed hospital, had 126 of its beds occupied with COVID-19 patients. Today, they are below 40. And they had a handful of patients on ventilators. And you can see that as you come up the hospitals that we have in the state. Yale New Haven Hospital, the academic medical center, was at almost 475 at its peak. And we are now at about 310 cases. Now, for every one of those people who's hospitalized, they're expecting the very best we have to offer, and they will continue to get it. But we're starting to see, I think, a light at the end of the tunnel. And as the governor said, we're doing about 20% of the surgeries that we used to do. We have the capacity now to ramp up safely. All of the hospitals are looking at how to do that, to both continue to take care of COVID-positive patients and to be sure that we can give safe treatment and the best that we have to people who need it. One of the key processes here, as the governor mentioned, is testing. And we have been ramping up our testing capabilities and are now proud to say that through a contract with the state, we can expand that tremendously. Thanks to the work of the governor's office, one of the limitations for us in the past was that we had the ability, we have staff, we do a variety of kinds of tests, 65,000 tests a day throughout the Yale New Haven Health System. We have 750 staff. COVID-19 testing required different equipment and required certain reagents, things in the supply chain like swabs that we were having trouble getting access to. And with the support of the governor's office, we were able to get far up in the queue with some of the manufacturers, with others in the supply chain. And what we have committed to the state is that we will be ramping up to 5,000 tests a day by the end of this month. We hope to get to 10,000 tests a day by the end of June. And later in the summer, we would like to get to 20,000 tests. And a lot of those, as we've worked with Josh Ball and the task force at Reopening Connecticut with our healthcare providers, is we're looking to see how do we make sure that we give priority, as the governor said, to high-risk patient populations, those who are in the hospital, those who are coming to the hospital, healthcare workers who are directly interacting with patients, working with local nursing homes, working with the prisons, working with some of our community partners to get testing sites out into schools that aren't being used right now so that we can make it more and more available to people who need it and want it. And I think as people become more comfortable that the tests are available and that these are reliable, it will give them a sense of where they stand, some comfort to be able to safely reintroduce some parts of their normal life. And also with contact tracing, which is something else we've been working on with the governor's office, when somebody is positive, to be able to understand who else may be exposed and contain that to hopefully avoid significant outbreaks going forward. So this is by no means over, but there's a lot of great work that's being done. And the last thing I would say is the partnership among the hospitals and the hospital systems in this state is really unprecedented. And thanks to the work the governor did in getting us all together, when we had particular demand in Fairfield County, with some hospitals really struggling with that load, we all came together and we stood up a regional command center that helped us figure out where patients could most safely be treated, where equipment needed to go, where staff could be redeployed. That's unprecedented, and I think it's one of the many very positive learnings that we've had coming out of this that we would be well advised not to lose and continue to try and nurture that as we move forward. So thank you for including me today.
Thanks, Marta. Yeah, I hope that is part of the new normal. All right, Oro, how was Jackson Labs able to ramp up testing so quickly?
So good afternoon. Thank you, Governor. Appreciate the opportunity to be here. It is truly an honor to be here with all of you today on behalf of the Jackson Lab. As a nonprofit biomedical research institution, helping to address the coronavirus outbreak as quickly as possible is absolutely critical and aligns with the Jackson Lab's overall mission to improve human health. I also, at this point, want to acknowledge all the first responders who have done a tremendous job being in the front lines of ensuring that all of us stay safe and healthy. We are proud to be a part of this important COVID-19 testing expansion to help the state of Connecticut recover from this pandemic. Our Connecticut licensed clinical laboratory in Farmington had until recently focused on cancer tumor to help cancer patients and clinicians identify potential treatment options. When the pandemic hit, we rapidly adapted our clinical lab's capabilities to now also test patient specimens for COVID-19. On March 24th, we began our work serving what today has become a network of approximately 30 local hospitals, nursing homes, first responders, and healthcare facilities in Connecticut to provide them with additional testing capacity. Today, with the support of the governor and his office and with our partnership with the state of Connecticut, we will dramatically increase our testing capacity while critically ensuring that we continue to provide 24-hour turnaround time in order to help the state's most vulnerable populations. This means that between now and July, we'll be expanding our COVID-19 testing capacity from 550 tests per day to 20,000 tests per day in the Jackson Lab. We'll achieve this new volume of tests by leveraging the commitment and expertise of our ordinary personnel at the Jackson Lab through the addition of automated equipment, increasing the number of trained technicians, and by leveraging our strong relationship with the University of Connecticut and our strong relationship with various suppliers. As a nonprofit research institution dedicated to solving the most challenging human health concerns, it's our humanitarian mission and duty to do what we can to ensure the well-being of our local community. The Jackson Lab is committed to this effort, and we are grateful to be part of this coordinated response to help our friends and neighbors throughout Connecticut. Thank you very much for the opportunity to speak at this press conference.
Well said, Oro. Thank you very much. Good to partner with you. Max, any questions?
News 8.
So for Marna, explain to me, please, the testing we were told only the testing works very well when you have symptoms. If you're asymptomatic, the test doesn't work as well. Is that true? As you're looking at the tests, what are we finding out about asymptomatic testing?
Is that for me?
I think so.
So I will tell you, I am not an expert in testing, but I have not been told that the test results are different if you're asymptomatic but have the disease, or symptomatic and have the disease, other than that your viral load may be greater if you're manifesting the disease. So, you know, I'm not aware that the test is less reliable in any way if you are asymptomatic.
And for the spit test, where are we on the spit test? You're looking at it, testing it. How successful is it? How far along are we with it?
So there are a number of people looking at the saliva test. We are doing several studies at Yale New Haven. There are other independent organizations that are doing them and hoping to get into trial this summer. There's a question as to whether or not independently they are as reliable as the nasopharyngeal swab. But, you know, I think over time that testing may be improved. But Oral, you may have a much better handle on that.
So I think, Mana, everything you said is my perspective of it as well. I think there is still validation work that needs to be done to show equivalency between the nasopharyngeal swabs and the saliva tests. So that's accurate, what you've described.
Channel 3 Eyewitness News.
Yes, Governor, you know, very positive stats coming out with the protective gear and the testing. But this comes on the same day where Dr. Fauci is warning of needless deaths if states reopen too soon. Is he talking about Connecticut when he makes these statements?
No, I think he's talking about places that are not following the federal metrics the way we are, as carefully as we are. That's why we spend a lot of time talking about the 7 key metrics, where we stand on that, making sure that people have confidence that we're letting public health lead our direction in terms of a slow reopening of our economy.
And really briefly on beaches, you know, we have a very good weather weekend coming up this weekend. Right now, we're seeing some of the guidance come from town by towns. They're making their decisions on their local beaches. Any statewide guidelines?
Yeah, Katie Dykes, our commissioner, has talked to all the municipalities regarding our guidelines on beaches, we as a state, and what they should be following. Again, it's the strictest protocols. We're very tough in terms of the number of cars that are allowed there. That's in many ways the easiest way for us to manage the social distancing on the beaches. I'm very pleased that our neighbors in Rhode Island have opened or about to open their beaches, so there'll be less back and forth. And certainly by Memorial Day, we're able to charge a differential fee for out-of-staters. So I think those are all ways we can tamp down overuse of the beaches.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. Governor Cuomo had said that he's going to require the staff at nursing homes to take 2 diagnostic tests each week. Is that something we're at the point, or the state's at the point of requiring?
Want to take that?
Sure. Well, we've, as mentioned in some previous press conferences, we've begun testing very broadly in our nursing homes, and we're working with the nursing home employees to test all of them as well. So we're ramping that up, and we'll follow the guidance of our public health team in terms of the frequency that's advised there as we continue to build testing capacity, which is becoming more and more available, as evidenced by the great announcements the governor made just a moment ago.
And also yesterday, Governor, you mentioned these children who unfortunately have been suffering from this multi-symptom inflammatory syndrome. Is the state going to be keeping track of the number of children who are affected and releasing those numbers?
I think we're going to be keeping very close track of that. I think maybe, Marna, aren't those 3 first kids at Yale New Haven, if you have any observations?
They're at Yale New Haven, and, you know, I asked shortly before I came up here, and I was told that all 3 are doing reasonably well. So, you know, there's a lot to be learned about that. I also understand that CCMC has a few patients, and, you know, as they become clearer about what is behind this inflammatory syndrome, I think that the treatment options will become clearer, but they're doing pretty well.
Fox 61.
Hi, Governor. So good news with the PPE shipment, but our inbox has flooded again with worried dental hygienists after your comments yesterday regarding people won't be heading to the dentist offices. But hygienists say their offices are booked until the end of June, and many are being asked to come back to work on May 20th despite fears of not having enough PPE or even being over the age of 60. So my question is, your stance the same as yesterday in terms of postponing reopening to a later phase? And then for Josh, has that dental committee that you mentioned yesterday, have they met already, and what's coming out of that?
Well, I'll start with the question. When it comes to the dental hygienist, it's worth remembering we never closed down a dentist's office. We recommended they prioritize emergency procedures, which they have done. So we haven't changed our protocols when it comes to, the dentist's office. We're being very careful in terms of people over the age of 60. Anybody with a pre-existing condition should not be going to the dentist's office, probably either as a patient or as a dental hygienist. We've done a very good job, I think, of making sure that everybody has the protective gear they need. Usually the dentist's office are at the front load there as well. So I'd like to think that we've been very careful. My hunch is you're not going to see a flood of people going back, but if they are going back, you can't have more than one person in the waiting room. We're trying to make sure the protocols keep all the patients as well as the staff safe.
Put together by our Department of Public Health to bring together the dentists and the hygienists to see if there's a protocol that works is going to have its first meeting tomorrow.
Is there any way, we're getting a lot of emails of dental hygienists who would like to be involved in that committee in any way? Is there any way for regular people to put their input into that committee?
I think there's more than adequate representation from the hygienists in that group. We've received a lot of interest in participating at this point.
And then lastly, any word on how long nursing homes will be closed to visitors?
I'm going to rely upon our reopen committee, but I think one of the smarter things we did was sadly not having outsiders go into the nursing homes early on. I see that it's still a very risky proposition, so I think we're going to be very careful about reopening that. Obviously, FaceTime and through the window is not an adequate replacement for in-person care or attention from a loved one, but we're going to be cautious about that for now.
News 12 Connecticut.
Hi, Governor. So this morning you showed us all the new PPE at the warehouse, but I'm curious, we've heard situations of, bad Chinese PPE showing up, especially face masks. I think Boston got a really bad batch that only provided 30% protection. How do you know this stuff is going to work? What kind of quality control did you do on it?
I can tell you that we worked with the highest levels in China and over at this side. So I think we know with a high degree of reliability who we are buying from and the quality controls involved there. That said, we don't take anything blind. We'll be opening, we'll be looking, we'll be testing as different people get access to this. But I have a high degree of confidence that we vetted the sellers very carefully on this.
And Paul, this question is for you. We asked the governor this morning, so we'll ask you and Josh now. Why was Renee Coleman Mitchell let go?
Well, the governor has decided to go in a different direction as it dealt with the Commissioner of the Department of Public Health. We wish Renee Coleman Mitchell all the best in her future, and we look forward to working with DJ Gifford, who will be taking on a dual role in the interim standpoint. With that said, we have an amazing group of commissioners that are working extremely collaboratively, and there's, I would say, overall standards that we look for all of our commissioners in terms of running the agency, but also making sure that they're adhering and ensuring that the overall mission of the administration is fulfilled.
I mean, she put out a statement just a short time ago saying that she was told it was not related to her job performance. Would you agree with that assessment?
I would say that every commissioner works at the pleasure of the governor, and the governor and this administration has decided to go in a different direction. We wish her all the best.
The Day of New London.
Hello, Governor. For you, I wonder if you could talk a bit about the distribution of the PPE. Now that we've got all this, how do you ensure that it goes to where it needs to be, the most urgently?
Yeah, well, right now, our first priority is to make sure that all of our hospitals, first responders, nursing homes, not only have the PPE they need for tomorrow, but have a little capacity there. I want them to have the confidence that they can use that appropriately. I think from there we're going to expand to other first-line responders, frontline, food service workers and the such. We do provide backup support for nursing homes, small business and the such. They take the lead in terms of securing their own PPE, but as needed, we're there to back them up as well.
Thank you.
Boceto Media.
Good afternoon, Governor. Yesterday, you reflected on for underestimating the impact of the deadly virus for following that advice of U.S. Surgeon Jerome Adams, comparing that COVID-19 with the flu, and some Connecticut residents are criticizing your judgment in the beginning of the pandemic. What would you like to say to them?
What was that about the flu and the COVID pandemic?
I can repeat my question. I said that this week you reflected for underestimating the impact of the deadly virus for following the advice of U.S. Surgeon Jerome Adams.
Oh, yes.
Comparing the COVID-19 with the flu, and Connecticut residents are criticizing your judgment from the beginning of the pandemic. What would you say to them?
Yes, the question involved the fact that the Surgeon General did come up to Connecticut probably 2.5 months ago, and he said for most people, COVID could be like a bad flu season. And that was not great advice. And I'm really happy that, Connecticut was one of the states that really took the lead in terms of social distancing, closing things down. I hope nobody got the impression out there that everybody thought it was going to be a really bad flu season, because a really bad flu season, we lose maybe 100, 125 people. We've lost over 3,000 of our Connecticut souls. So that was not the right message.
My second question, Governor, would be Dr. Fauci said today that reopening schools and universities in fall could be serious, especially since it's taking vaccination in 2 years. What actions is the state going to take since you guys already presented plans to the state?
I'm afraid you broke up a little bit, but I think the question again was on Dr. Fauci. We have talked to Dr. Fauci. We sort of are supportive of the guidelines that came out of the task force. I thought they were constructive. We refined the guidelines here at our own state reopening committee, led by the science, led by the scientists, and that's why we're following those metrics very carefully. We're not being premature on this.
The Hartford Current.
Hey, Governor. I have a question about the contact tracing component of the reopening criteria. Can you explain to me the concrete goals that you would like to see the state get to on contact tracing by May 20th? I'm thinking maybe the number of volunteers that you'd like to have at that point, or the number of participating health departments, things like that.
Yeah, let me start with that and then hand it over to Josh. Look, hand in hand with all the testing that you're hearing coming from Jackson and Yale and Hartford and others is the fact that we have to be able to follow up with people who are found to be infected. We have to find out who they've been in contact with. And that's one of the reasons we've said, look, keep your groups to 5 or less, so that there's many fewer contacts that you've had over the course of that 3-4 days that maybe when you were infected we didn't know it as yet. They, in turn, were reaching out to all of the health departments across the state. We've already got the Microsoft platform up and operating. Josh can tell you how many of those calls are already beginning to be made. We're starting with our local public health departments. We're starting with our Department of Public Health as we bring on volunteers. So as we go along with more testing, contact tracing is way we can contain any potential flare-ups out there.
Yeah, I think perfectly said. The goal and our criteria for contact tracing was to have the system up and operational, and so this week that system is up and operational, and we're onboarding the first public health departments this week, and we'll be off to the races. The first priority, as the governor said, is getting the local health departments all stood up in collaboration with our hospital systems, as well as Marna mentioned earlier. And then from there, we turn our attention to the volunteers and the additional staff that can become the surge capacity for our local health departments. If there is a flare-up in a certain area, we can deploy more resources. That's really intended to be live for the summer in case we, as we start to our gradual reopening, if we see flare-ups, we have resources we can rapidly deploy.
So can you give me some numbers with that? So as far as volunteers and staffing, how many do you think you need by May 20th, and how many do you have right now?
Right. So for May 20th, as I mentioned, the focus is on our local health departments. So between them and our State Department of Health, we estimate we'll have 300 people contact tracing on the platform. And then, as we mentioned before, our goal is the next phase is to get to 400 to 500 volunteers staffed up as well to complement those teams.
And to clarify, how many do you have right now?
So those 300 local health department officials and our State Department of Public Health are on board right now. Those are full-time employees that work at those organizations who will be trained on this new platform.
Thank you.
You're welcome.
Connecticut Public Media.
Ali Warshawski for WNPR. This question is for Marna. You mentioned the decline of hospitalizations from beds used for COVID patients. Are they throughout the Yale New Haven Health Network manageable, or is there a number you'd like to see that would make it more manageable for staff, as we reopen the state?
They've been manageable at all levels because our role is to be there and to be able to care for the patients who come to us in need. Where would we like to be? We'd like to be at zero. One of the things that we are doing as part of our work with the governor's teams as we look at reopening is to try and project with the best science that's out there from various models what a sustained level of COVID inpatient demand is likely to be. And we believe it's going to be less than where we are right now. It won't be zero, and we will make sure that those patients are cared for well, but that they are cohorted and the staff who care for them are also dedicated to them so that we do the best job that we can for those patients as well as for others who seek care.
Thank you. And my last question is for the governor. We had a listener write in. They were looking for an update on applications for pandemic emergency unemployment compensation. I'm assuming that's the extra $600 a week. Is everyone who applied for unemployment getting that, or still some people still waiting for that additional fund?
I believe all those, that's the true up from the federal government, that extra $600. It took the feds a little extra long to get the guidance out on that. They've done that over the last couple of weeks, and it's my understanding the Department of Labor has got all those deposits made, or at least in process, about to be made.
And it sounded like maybe there was also an interest in the PUA, which is for the self-employed, the gig workers that started going out last week. Those processes are flowing and the payments are going out. We are aware some people are running into some glitches if they enter their Social Security number wrong, and our Department of Labor team is constantly working to continue to enhance the system and answer those questions and make sure everyone's getting the support that they're entitled to during this very difficult time.
Hearst, Connecticut Media.
Hi, Governor.
Hey, Ken.
Can I ask you a little bit more about the value of the PPE that we saw at the warehouse today, and what was the role of the Chinese construction bank?
I'll start it off, and then maybe Josh, you can do this. Let me tell you how complicated it is negotiating something like this, and it really took a while, and all the different relationships that are necessary there. The Chinese Construction Bank is they made a significant donation as part of a goodwill gesture. I think it was probably $2 million plus, so it was significant. But for us to get to the front of the line with everybody trying to source PPE coming out of China, where let's say most of the PPE comes from, took a variety of relationships. That was one of the relationships, the Consul General, Ambassador, others that were very helpful as we tried to navigate through this.
Josh, yeah?
No, I think the governor summed it up well. I mean, when the market broke down, you know, in March, I think it was, right, and supply and demand went completely upside down, it really became, as the governor said, you know, a scramble, right? And so we're fortunate that the governor has, you know, incredible relationships in the business community with people with extensive relationships in China that could be called on to help broker some of these deals like the one that was announced today.
And what's the number we're using on the value of the warehouse full, the 6.7 million pieces?
It's over $10 million in value.
10 million. And can I ask a follow-up question on the nursing home testing? Is there a schedule that all the staff are going to be tested by? Is there a calendar? Are you just seeing how many you can do in X number of days?
Yeah, it's being prioritized by our Department of Public Health team that looks after the nursing homes and where they see the greatest need and where they want to prioritize the resources that are being deployed. So that will continue to unfold in the coming weeks.
Is that going to unfold into the assisted living also?
Yes, we're looking forward to that as well.
Okay, and I think, are they going to continue once they go through once of all the nursing homes? Are they going to keep going around again, keep testing people?
Yes, so one of the reasons these announcements that we made today with Yale New Haven and Jackson Labs, and there's more in the works to really scale up our testing capacity, is because for these at-risk populations, we want to make this repetitive. We want to continuously be able to test on a weekly basis for these most at-risk populations, particularly in congregate settings. So that's why we're so thrilled to have the partnership with Yale New Haven, with Jackson Labs, and we'll be announcing more in the coming days and weeks.
Thanks, Josh. Thanks, Governor.
WTIC 1080 News.
Hi. Just today, Governor Baker in Massachusetts put in for a $1 billion supplemental. Rhode Island, Governor Raimondo is talking about furloughs for state workers. It just reminded me to ask, how are things shaping up financially for the state the end of this fiscal year into next?
It's not that pretty. We're probably looking at a $1 billion deficit in this fiscal year that ends June 30. As you can imagine, we went from being in pretty good shape to a deficit, and that all happened in about 90 days. You know, that said, thank goodness we've got a $2.5 billion rainy day fund that allows us to power through, at least for this calendar year. We're looking at next year. That's going to be a deficit probably of $2 to $3 billion. It really depends how soon the consumer gets their confidence back and what we do with this COVID, how we get it under control. If people can slowly start getting back to work, we see the sales tax coming back, income tax coming back, we'll be able to weather this without a lot of severe cuts. And I think that's what our goal is.
And Marna, it was a few months ago that we heard about the possibility of a relapse this fall, and that's still being talked about. Do you think the hospital system can withstand that potential?
We will withstand whatever demand comes our way, and we are prepared and looking at the same models, and will be prepared if there is a spike late in the summer, in the fall, whenever it comes. I think we're all hoping at some point for a vaccine that we can administer like we do the flu vaccine, so that we will be able to have more predictable demand, but we are all prepared to handle what we need to.
Thank you.
The Waterbury Republican American.
Thank you. What about test turnaround times? There were, an additional 568 cases reported a day. How many of those were reported in the last 24 hours, and how many were reported in the last week or so?
So I don't have that breakdown at hand, but what I can tell you is that back on the partnerships were announced today with Yale New Haven and Jackson Labs, it's worth noting that they're both Connecticut-based operations, and one of the things that we prioritized in the RFP that we put out a couple weeks ago that's led to these relationships is the importance of the speed of the turnaround time on those tests. We know how important it is to get those results back in 24 hours get into the contact tracing platform to be able to head off any further spread. And so that's why we're so fortunate in the state of Connecticut to have such great partners here, because when we can deliver the tests locally, we get them turned around quickly, and that's what both of these organizations have committed to do.
Or do you want to speak to that for a second? The turnaround on the tests?
Happy to, Governor. So what Josh said is exactly correct. Upon receipt of the samples at Jackson Lab, we will absolutely be turning those test results back around within 24 hours. The ability to turn around those tests, as Josh described, is immensely important, particularly for those people in our population who are the most vulnerable. And what we are doing to ensure that is we are also scaling up our operations. As we speak, we are implementing automation systems. We are bringing additional people on board, and we are very confident on our ability to scale up to get to 20,000 tests in July per day.
In terms of the RFPs, how many were received, and how many have produced some sort of, I guess, contract with the state?
I think we've received over 20 at this point, and these are the first two who've gotten across the finish line, but as I mentioned, there will be more.
And in terms of the self-certification, when is the Department of Economic and Community Development going to have that online system set up so businesses that want to open on May 20th can submit their plans and self-certification information?
Yeah, I think that's going to be up certainly before the end of the week, if not a little bit sooner. The team's working very hard on getting that up now.
Okay, thank you very much.
CT News Junkie.
Governor, I was curious. Dr. Deborah Birx cautioned governors from including hair salons and barbershops in their first round of reopenings. So why is Connecticut moving forward with this in the first phase?
Well, in this phase, obviously, we're close to 20 days in terms of declining metrics, so we're pretty long in this phase, I would say. It's on a totally voluntary basis if people want to open or not. We found a great number of people that wish they could go back by appointment only with the strictest of protocols, and making sure that anybody who does not feel comfortable going back, as an employee, for example, doesn't have to do that, could be furloughed or continue to collect unemployment. We've got the safety of the employees paramount in our mind.
And my other question was, has the Reopen Committee hired a consultant?
No, but we have. The state of Connecticut has, and that's advising the governor, our senior staff, our commissioners, and is working with the Reopen Committee as well.
Okay, and their name is?
It's Boston Consulting Group.
Okay, thanks.
Yep.
The Connecticut Mirror.
Good afternoon. So if I hear you correctly, on May 20th, when the first reopenings occur, Connecticut is going to have a tracing workforce of 300. Why should Connecticut be confident about your ability to track any further outbreaks, given that the National Association of Health Directors recommends that a state with the population that Connecticut has should have a workforce of closer to 1,000 contact tracers?
Yeah, I mean, I think the thought is that you want to have the contact tracing fully implemented once you've come down the bottom of the slope and where you can cover all the cases, right? And as the governor said, we're coming well down that slope now, and it's really about having that workforce in place to then be able to cover every single positive case that's identified in their contacts and prevent those future spikes. So, you know, as we continue to come down the curve, we know that there's always a 2 to 4 week lag time that we're going to wait before we go to any future phases. That's because of the transmission lag time that occurs. So we'll be well positioned with the larger group when we need it.
And what does well positioned mean? You're going to have how many of those volunteers in place by what time?
Right. So our goal is to be fully staffed by the end of June.
To have all those volunteers in place by the end of June?
Correct.
Okay. And I think, look, I think we all appreciate that you all are putting together a system of testing, a system of tracing as you move forward to May 20th. But on the question of testing, it's still a little squishy here. Can you give us your best estimate of the schedule? At what point can you tell nursing home families that their loved ones will be tested, all of them, and their staffs at those places? And then the same is true of assisted living. What is the rough schedule there?
Sure. Well, I think we've announced that our goal is to have all nursing homes tested by the end of this month, and the team's making great progress on that. You know, look, as we bring on more capacity, we're able to test more and more populations. You know, we're focused on our correctional facilities, we're focused on first responders. So the circle of people we can test and test more frequently continues to grow as we ramp up. And that will continue straight through the summer.
So assisted living people are going to have to, you're talking June at the earliest, it sounds like.
Yes.
Okay. And then the last question, how is that testing being done? Do you have DPH staff or laboratory staff going to these homes, collecting samples, and then transporting them?
So it's a mix. We typically in the nursing homes rely on the nurses and the medical staff there to do the sampling. Our National Guard teams are out delivering the swabs, making sure they have the materials, and often collecting them and transporting them back to the labs. In some cases, they're actually helping with the sample collection. So it really depends on the capacity of the home itself and how we can best serve them.
All right. And last question. You know, again, I understand why there's an ad hoc nature to what's going on. But at what point are you going to be able to give a comprehensive view of a system that will be in place for the summer and going forward on schedules for testing, what the people of Connecticut should be able to expect from their government on testing nursing homes, testing, you know, delivery of PPEs, all of it? Because again, it just has this ad hoc feel to it. And I understand, you know, there's a reason why.
I'll start. I mean, we're doubling our testing capacity almost on a weekly basis. You've heard from Josh what we're doing, Paz, in terms of ramping up on a volunteer basis right now, all the track and trace we can. As Josh said, it's closely tied to what we're doing on the testing front, closely tied to being on the downside of the curve so we can make a meaningful distance in terms of track and trace. I think it's going to be a program that's with us for some time. Maybe the COVID pandemic slows a little bit. As Marta said, there may be a flare-up again in the fall. We're going to be able to get ahead of that. And what track and trace allows us to do is to contain it in a serious way.
Yeah, and I just add, Paz, I think you know, a lot of the questions and discussion in these are focused on, you know, the first phase of this reopening on May 20th. There's a tremendous amount of work that's going on as well around, you know, what does a phase 2 look like? What does a phase 3 look like? What are all the supports we want to have in place for those around testing and contact tracing? And our thought is that we would get into that in more detail in next week once we get to past May 20th.
Well, I'll tune in next week. Thanks.
I'm sure you will.
The Associated Press.
Governor, as this testing ramps up, can you talk about your own personal decision? Have you been tested? What goes into your decision as to whether and how often you should be tested? And then can you talk about other public officials, lawmakers opening the Capitol, people who can't obviously stay at home? What is your recommendation for testing for public officials?
I held off because I thought we were very limited in terms of our testing capacity. This is going back a few weeks. We said people who are showing symptoms should only do it. But that said, testing has opened up. It's now more available. In many cases, we're encouraging people to please go and get tested. So I led by example today. No results yet.
Which test did you get, and what went into your decision?
What went into the decision is I am out there encouraging people to get tested right now. I don't want to see this hesitancy. I don't want to hear people say, not for me, I'm worried about the possibility of a quarantine. I don't want to hear what's going on. You know, as Marna and Oro said, we're taking the testing to you. We're taking the testing to the communities. It's a responsibility you have, not so much just to yourself, it's a responsibility you have to your community and your family. And, you know, I wanted to lead by example. It's a very different place we were on testing just a month or two ago.
And then in terms of other public officials, what is your recommendation? Lawmakers coming back at the Capitol, getting tested, that kind of thing.
Well, I'm very reluctant to give recommendations to our legislators, but I think they're all making the individual decision themselves. When they come back is up to the leadership. Paul Mounds has been in almost daily contact with them. I think appropriately they don't think May is the month to do that. It's still too early. I think that may be our last question. I just want to follow up on what Ken Dixon said in terms of, you know, friends. I was just thinking, you know, Connecticut has some really good friends, and it allows us to punch above our weight class as a, you know, relatively small state. With some friends, we got to the front of the line down there when it came to the mad rush for PPE. Remember what a situation that was a month or so ago. And we now have a 60-day supply. We actually have our own stockpile. No more waiting for Washington, D.C. Connecticut has a stockpile, and we're going to build on that going forward. You know, as you maybe know, we've had the head of Quest Diagnostics. We had the head of Thermo Fisher. We have those folks that are so key to getting the ingredients we need to do the testing, which is just the foundation of getting our state back going again, reopening a serious way. Larry Merlot from CVS made Connecticut one of the very first places where we did the drive-through testing. Connecticut has some good friends. And we also have one of the great healthcare systems in the country right here. So we look to ourselves when it comes to how we get through this. We have some amazing innovators. You've heard about some of the experiments going on. We got Jackson Labs. Oro, I can't thank you enough for what you're doing and the leadership Jackson is taking, helping us ramp up, helping us think about you know, diagnostics and therapies that may get us through this. And Marna, working with the hospitals, working with you taking the lead on this. We got through April as well as we could have hoped for, and we're ready for what comes next. Thanks, everybody.